I'm here with Carm and Amanda. Why don't you guys introduce yourselves, because I'm horrible at introductions. I mean, everyone knows who I am, but Carm, why don't um, when I spoke to you, I mean, I've spoken to you lots of times over the years, but the most recent conversation, it kind of inspired me to say, let's do a podcast. Let's talk about stuff. So why don't you tell everyone what some of the things that you've been up to?
Okay, so my name is Carm. I'm a child and youth care practitioner. I'm an educational support specialist. But what I'm most passionate about is my platform, Girls Gotta Heal. And it's a platform I created about 2 years ago as a way for me to start talking about my grief and connect with others. It's a community I created to just bring people together to talk about mental illness and the various losses that young people go through.
And that's spectacular. And I mean, I've talked to you about all your stuff over the years,
Yeah.
but I don't think we ever discussed in length, or I didn't realize like how much you've invested in, especially the social media aspect of things and reaching out, because you have a lot of followers and you're connecting with a lot of people. I'm sure helping a lot of people as well. So
Yeah.
we're going to talk about that.
Mhm.
I wanted to introduce also Amanda Morelli, our latest addition to Tri Health, a naturopathic doctor. Why don't you tell us a little bit what you like to focus on, what you've been up to?
Yeah, definitely. So I am Dr. Amanda, naturopathic doctor, and my biggest focus on is helping people with their gut and their hormonal imbalances. And the reason why that is I got into naturopathic medicine for my own gut reasons, gut issues, and that kind of just helps me realize where people are coming from because of things that I've gone through myself. And that just made me really passionate about gut health. And I just love doing that. I love helping people, helping them, just even empowering them to be able to take care of their own health and giving them the tools and the resources that they need in order to help themselves. So that's pretty much what I focus on a lot in practice.
Awesome. The two things that stood out is you both mentioned like what you're working on was like maybe initiated or fueled by what you've gone through.
Mm-hmm.
Yeah.
I mean,
Definitely.
how important do you think that is in like motivating you, inspiring you, helping you inspire others? Like, you guys jump in.
Yeah, well, definitely for me as a young person going through grief and mental health, I struggled a lot. I couldn't find the right resources for me. I couldn't find that community. So I always thought to myself, as I was working on my own things, I'm like, when I feel well enough, I want to create the community that I always wish I had. And yeah.
What do you think? What was one of the first things you wanted to introduce to others that you felt like you missed out on, or you discovered along the way really helped you?
So I definitely started with talking about grief for young people. And for me, I struggled a lot with just finding the right peers to connect with. A lot of the people at the time I was surrounded with didn't really get me or understand. So I focused a lot on just taking your time and finding the right people to help you and the right people to understand you as well. So just fine tuning your circle.
Mm-hmm. Okay. As you did that, did you find that circle grew?
It grew. It started super small, but it eventually did grow.
Yeah.
Yeah.
Yeah, because you have a big following on Instagram.
Yeah. It's all right. Not bad.
No, it's good, and it's rewarding, I'm sure, because I'm sure you get feedback that what you're putting out there is helping and touching people.
For sure. Yeah. I get like such great DMs all the time. And I speak on things that I'm going through at the moment. So one of the most recent things that were big for me was talking about fertility preservation, which I did last fall and which you helped me with as well. And I got so many messages from women who went through it or were just curious about it and they hadn't had someone talk about it that they were following on Instagram. So just connecting with a lot of different women going through different reproductive health issues and having questions.
Amanda, in your practice, what do you see as a common trend in terms of with mental health and reproductive health? Because I mean, my experience, I've seen a lot of correlation and some things that were like maybe obstacles. And then when, the work that the individual put into their care, they started to find that they were overcoming some of those obstacles. Anything that you can comment on that?
Yeah, definitely. I think just even the stress around that, if somebody is having fertility issues, reproductive issues, it puts a lot of stress on them, and they might not have the support or proper community to help them going through that. And I just found that a lot of people just like being heard and explaining what they're going through and having somebody to sit there. And I think that's where we really shine as naturopathic doctors. We take the time to really listen to people and have them explain their issues to us. So I think helping through stress, and that is a huge issue, stress and anxiety in relation.
Yeah. I think just our system right now, in terms of like the standard medical system, it's not conducive to like long conversations. Hey, how you doing? It's more like, okay, you have your results, see you in 6 months. Where then obviously there's a gap there, and both your guys as practitioners or caregivers or a soundboard or someone that can offer some kind of input, I think that's making up a big gap in the care that people are looking for. What do you think is like, in terms of social media, what's a good use of it? Because I think that there's a lot of good information. I think there's a lot of stressful information. Like, I mean, even when someone Googles a symptom, Googling a symptom is, I think that's going to become a condition, like a Googleitis.
Yeah.
Because once you Google it, you've got all, it's like, I got all of this. You got to, now I have to rule it out.
Definitely.
Yesterday I heard something. I mean, I'm not doing it justice because I think it's a whole concept on its own, but paraphrasing, it's like a misled or misinformed belief. It takes more energy to disprove it or correct it than to develop it. So when we get a lot of bad information, sometimes it's worth worse than no information. Yeah. So how do you help people kind of weed through that? In terms of your own experiences, what have you found is useful? What are some of the pitfalls, or what are some of the signs that you can look for that's like, okay, this is someone that I should listen to? Because obviously, Carm, you're reaching out to people, you're touching people, and they're listening and they're responding. So what do you feel, how do you tiptoe around that?
I think it's important for people to kind of like tune up who they're following on Instagram based on like how they're feeling. Like if you're watching someone's stories and it doesn't make you feel good, mute them or block them or whatever. But you want to find someone who not only just shows you the end result, but also the whole process. Like, and I try to do that on my page as well. Like, it's not always perfect. I can be talking about healing and what I've been doing over the last 10 years. But I definitely have fallbacks as well. I have weeks where I'm completely off or I need to reset. So I think following people who are very honest about the journey is important as well. So you don't just want to see all like those best moments and that end result. You want to see, the ups and the downs, and that makes you more relatable and people can connect to that.
Sure. And anything?
No, I definitely agree with that. And I think we have to sometimes realize that Instagram can just be a snapshot, kind of what you're saying. Yeah. It can just be a snapshot of the best moments, and people just use the highlight moments a lot of times. So I think that's a very good idea for like fine tuning who you're following and just looking at and seeing how that makes you feel. And definitely, I see that a lot where people do a lot of self-comparison, and it can be very, very hard on people's self-esteem and image and everything by comparing a lot on social media. So whether that be you need to take a little bit of a digital break, a weekly, daily thing to break from it, if that's something that you're noticing you're doing a lot, I think is also helpful.
Yeah.
On the flip side, though, I think it can be really helpful for young people because sometimes young people don't always have access to like therapy or seeing a naturopath or things like that can be helpful for their wellness. So I think it's sometimes a good foot in the door to just get that quick information that is coming from a really credible person. You know what I mean?
Yes,
Mm-hmm.
definitely.
Yeah, but I mean, this conversation can diverge so many different directions because I mean, social media, I think it's double-edged sword, and it can do harm when if you're not scrutinizing who you're following.
Yeah.
And also like it, and I think you said it well. It's like you kind of have to vet who you're looking at, and if what they're saying isn't making you feel better, then they're probably not a good resource for you. I'm of the opinion that sometimes you need to hear some hard truths, and that has to be peppered in with some confidence building. So I mean, with my patients, I've been accused of being a bit of a jerk at times, which is understandable.
I can't see that.
Oh,
come on! I've seen you for like 3 or 4 years. I've never.
You should have seen me 5 years ago.
Oh no.
I've toned it. No, I think, and I go back and forth because I feel like, as much as we're trying to support and help mental health, I think that there's practices that are contributing to it, and I think there has to be some way for someone to face adversity and take it as a positive and it's constructive without it feeling like being bullied. So where do you, like, how do you, in terms of governing yourself or your relationships or your friends, where you're willing to be that voice of reason?
I don't know. I kind of agree. Like, I kind of feel that, like, someone has to want that change for themselves. And sometimes they're not in the space to hear those hard truths. Sometimes those hard truths are like little seeds that you're planting. But ultimately, at the end of the day, someone has to want that for themselves. And that reminds me of, I always talk about this with you. I put so much into my own mental health and physical health. And sometimes the people around me, like my family, struggle to do that. And it frustrates me. And I'm like, and I give them the hard truths. I'm like, you need to do this. Like, this would be helpful for you. And they're like, yeah. And I'm like, it really affects me. But I have to, like, not let it, I have to put a boundary in place and just focus on myself. So I think ultimately sometimes people aren't ready to hear it, and they have to be wanting that for themselves.
Anything?
I can definitely relate to that too. When, you're trying to just be that health advocate for people around you, and they don't want to follow what you're saying. And you have to just realize that they're not ready. And you, like you said, you can plant little information along the way, but in the end, somebody has to be ready to make those changes.
Yeah. And it's hard, I'm sure, that when you're working so hard and you're seeing others that just like, you're doing this and I'm seeing you do it and I wish you wouldn't and I wish you'd listen. But it is an opportunity to build up a bit of a thicker skin or a boundary, because what other people are doing or not doing can't necessarily sabotage what you're working on. So, and it also does bear fruit, because it is planting seeds. Because if you do all this work and make suggestions or gentle reminders, in time you look back and you'd be like, they did listen. At least
it's a spillover
heard.
effect.
Yeah.
I 100% believe in that.
Yeah.
So it focus less on giving that information and being so hard about it, and just act as a model. I think that'll be more effective, honestly.
Yeah. Because the more you tell someone to do something, they're going
to.
Yeah. What are some things that you found as tools or skills that have helped you in terms of even just kind of resetting yourself? Maybe you've been having a bad week, or something happened that put you over. What are some things that help you kind of get back and get back on your your healing path the way you want it?
For me, a big one is disconnecting. I literally have to separate myself. I have to disconnect from my phone and just limit who I'm allowing around me. That's the best reset for me.
Yeah, for myself, I would say is realizing that there are certain things that I have control over and ones that I don't. And for example, I can just give a basic example, like driving in traffic. Mm-hmm. And it is so stressful, and people stress themselves out, and you
don't like traffic.
And you get yourself worked up and angry about things, and then you have to take yourself away from that situation and realize these are things you don't have control over. So don't get yourself so worked up over it. So that can be applied to so many things in life. And I realize sometimes I can do that and get angry over things I don't have control over, instead of focusing my energy on things that I do have control over.
I also like doing things in traffic that I enjoy. I listen to videos or...
Yeah,
so
exactly.
Sometimes, if I have like an early day, and like let's say I'm not a morning person theoretically, the drive-in is actually my chance to wake up. I mean, I'm awake when I'm in the car, but
I would hope.
I drive. Yeah.
It's a mindset shift,
Mhm.
honestly.
Yeah.
Just like shifting how you're viewing
Yes.
your experience.
Yes.
I play a lot of video games. I feel it's constructive.
Can't relate.
I can't really either, but I do. I read
You
a lot of
guys-
books.
Oh,
Like-
that's not the same. What kind of books? Like fantasy?
No. I would say like books about
Health?
and then
Oh.
also just like mindset stuff and yeah.
Really?
Yeah.
Because to me, that's like work.
I
That's like actually more like school than work.
I like it.
Yeah.
I do read then. I'll sometimes read books.
Did
that
you
are
grow up
just-
wanting to be a teacher?
No, I didn't.
I'm a big fan of having a big chunk of your day devoted to just being dumb,
Yeah.
like emptying your brain. I just find that I need that.
I watch a lot
That
of
would be-
reality TV.
That would be like TV. Yeah,
Yeah.
watching TV would be probably a way to
Okay,
do
I mean,
that.
I
Yeah,
think
yeah, yeah.
watching TV is my equivalent to
Yeah.
like my playing video games.
Yeah, yeah.
Fair.
Fair enough.
Okay. What triggers you? What bothers you? What are some things that even though we kind of know better, what kind of still gets us?
That's a huge question. Where do I start?
Well, how about you tell us
Yeah.
yours?
I can base it on practice, on my practice. There's times when, you tell someone something so many times and then they don't do it. And then either they come back. No, not talking about you. They come back and then they tell you they found this amazing thing. And it's exactly what you've been telling them
Oh,
for
yeah,
years.
yeah.
It's like, oh, okay. Well, I mean, I guess you had to kind of figure it out on your own. When you go above and beyond for someone, and then they just kind of give you a bad response, negativity coming back. It's like, I went extra, and yeah. But then what always happens shortly thereafter is someone that I did, the standard, and they really, really thrived or responded well and really appreciate it. And then it's like, okay, yeah, that's why I do it. Because
Yeah.
otherwise, I'd be a professional video game player if I was any good. That's my trigger. Sharing time.
Gosh. You want to go first?
I'm
still, like,
trying
formulating
to
it.
think of what my
How long you been in practice here?
here
Yeah.
at Tri Health.
Like 3 weeks?
Yeah.
Anyone bothered you yet?
No.
Okay.
No.
Okay. Just making sure we're not contributing.
No. Nobody.
How
bothered me.
how was school? How was
Oh.
your education? Did you enjoy all of it?
Some of it I enjoyed.
What did you not like? Say names.
Oh no, I'm not saying names. I
Okay,
would
so
say-
supervisors.
I would say it would be more. More hands-on experience. Like we had a lot of it, but just I would like even more of it rather than more of the classroom stuff. Yeah.
That's what the practice is for.
Yeah. Well, we get to have a bit more too, but yeah.
Yeah. Oh, okay. The first day I ever stepped into CCNM, I was lost. So I went to what's called the multi-purpose room, which is kind of just, it's a classroom or anything when they need it. Because there was a sign that said registration and it pointed in that direction, but that direction was an entire wing. And I just went to the first door. Okay. And I sat down in Dr. Saunders. I was January intake, so this was just after the midterm exam of Bot Med second year. So I sat in the review of the exam of the hardest course. There's 4 people in there, and they all look very unhappy. And it took me about 20 minutes to realize I'm in the wrong place. Wasn't until 2 years later that I'm like, oh, that's why everyone looks so miserable. I had a vision of this a couple.
That's so funny.
Yeah. So we didn't leave. You still have to say yours.
I would say like it's not that deep, but my triggers would be sometimes holidays, just based on my grief,
Mm-hmm.
and also people assuming things about me. So early on in my career, I had completely bleach blonde hair, long acrylic nails. I looked very young. Sometimes people still say I look very young, which is annoying at times. But
I hate that.
so
I get that too.
so it's just people judging me off of what they think I am based on my appearance.
And then you speak.
And then I speak and then I tell them my story and they're like, "Oh, wow, I didn't know that about you." And it's like,
you
well,
have depth.
yeah. I can have bleach blonde hair, long nails, and have depth and have gone through it as well.
Good. All right. Bleach blonde hair is in. Where do you see your account and your mission? Where would you like to see it go next?
So right now I'm working on certain things that I cannot talk about, but big exciting things coming up. You know, but I can't talk about it.
No. That's good.
And I definitely want to develop more programming. So over the last 5 years in like my career, I've been developing programming. So I think I can apply that to Girls Gotta Heal.
Mm-hmm.
And I'm all about like fine tuning the experience. I don't think one box fits all for everyone. Like that can apply to everything, literally. So just developing programs that suit
This looks like a university course.
Okay.
I hope I'm not overstepping, but I think you can totally, translate this into some kind of psychology program.
Yeah, that would be amazing.
Yeah, you should. What are some things like? Is your account a little bit more like, this is what I'm going through right now? Hey, shoot me a DM. Tell me what are you feeling? Does anyone do that? Is there like a lot of one-on-one interaction?
A lot, yeah.
How is that tiring?
I think at first when I was receiving those messages, I was like, this is awesome. Like people are actually responding to what I'm saying or can connect with what I'm saying, and I would like it. And even though I would be like, I wouldn't have a lot of mental space left in the day, I would still carry on and respond. But now I've become better at like setting boundaries and like not opening up all the messages at once or saying, hey, I'm just busy right now. I'll respond to you when I can. But yeah, it's overall a great feeling. I've become better with setting boundaries.
I'm just thinking out loud.
Okay.
I mean, as things grow, I would say get a moderator or someone that can help, like on a voluntary basis, sort of like screen and answer some things, like as a vice president. And I remember because I know you, and I know that there's elements of us that always want to help, and we're like givers. Yep. I mean, I'm not saying we, but in general, there's a group of people that are the empathy doesn't stop. Yep. So, but then you have to have a little bit of left in the gas tank. And I had a patient way back, and she was great, and she had terminal cancer, but you would never know talking to her, and she would give so much support to other patients that would be in the clinic, and because we used to do a lot of like intravenous, like in a group session, like 2-3 people at the same time, and she would be the one kind of like giving pep talks and encouraging and giving like direction. And then I'm like, and at one point I'm like, oh my gosh, like so you should talk to so and so because she's going through it, and she's she'll really uplift you. It wasn't until like maybe a year later where I started seeing her mood wasn't quite perky, like, and it's like, and then she started like, yeah, you know what, it's getting hard to do this all the time. She goes, I love to, but so then at that point I'm like, okay, I can't tell anyone to call her up or anymore. Like I kind of knew that's like she was a resource, but maybe her resources are needed for her right now. So that's one thing I always tell people is like the airplane metaphor, when they show the video and it's like the gas mask or oxygen masks come down. Yep. And like when someone's not ready for that question, they're like, yeah, you put it on, you put on your kid and then you put it on yourself. And I'm like, no, it's the wrong answer. So, if you're okay and you can help the people around you. So that's something I try to get people to kind of focus on. Amanda, in your practice, how do you feel about that? What's your experience with that?
Yeah, definitely. I even find that a lot of people in their maybe 50s or 60s that have been helping like with their kids their whole lives, and then they get to that age and they don't really know what to do anymore. They feel like they still need to be helping out their children or other people, and they don't give that time for themselves. So it's a big thing I talk about with people is having time for yourself, some relaxation time, some time to decompress and take time for yourself. It's a huge thing that I talk about with a lot of people because, like you said, if you can't take care of yourself, then how can you help others? So, yeah.
I want to speak a little bit more clinically because like PCOS and that entire spectrum is like, I think it's an epidemic level. Why do you think so? You can just guess or say a theory. I don't think there's a right answer right now.
You know what? I'm not too sure, but I think it could also be just it might sometimes just be given as a diagnosis when it's not really looked further into, if that makes sense. Yeah. So sometimes people can just be told they have PCOS, but they're not really given all the proper blood work or the proper investigations to find out what actually is going on. And then there are different root causes of PCOS, and insulin resistance is one of the main ones, and that is a huge thing in our world happening right now. A lot of people have insulin resistance and they don't even know why.
Yeah.
Diet, the things that are in our environment, lack of exercise, our very busy, fast-paced lifestyle, stress can lead to insulin resistance. Yeah. So cortisol.
Yeah. High stress, higher carb intake, lower physical activity.
Yes.
That's maybe just the recipe there, right?
I think so too.
Yeah.
Yeah.
It seems like it. So someone who has that, what should they do?
So if they have the insulin resistant type,
we'll just pick that one.
Yeah, let's pick that one. So the best thing is to just increase your protein and fat intake, reduce the amount of carbohydrates that you're having. So protein and fat with every meal. There's definitely certain supplements that we can help with that, like berberine is a great one, and inositol is a good one too. Even just checking levels of vitamin D, that's also linked with PCOS, so optimizing that. And then helping with stress management, helping with physical activity, but actually resistance training is actually shown to even improve insulin resistance more than you would think that cardio would help.
Yeah. A lot of, everyone I've been speaking to in terms of like whether it's personal training or, any kind of physical fitness, there's a bigger push now for resistance as opposed to cardio. Yeah. It's almost like, when would you use cardio now? I think people are kind of like, why am I going to spend 45 minutes on an elliptical, exhausting myself, and then the benefits are done as soon as you step off. Whereas resistance training, you're building up muscle, metabolic rate improves, you get lasting effects.
Exactly.
Yeah.
Yep.
Okay. Well, we figured that one out. Carm, in terms of supplements or anything that you used for mood, for stress, for anxiety, for anything like that, what do you find? What's your experience? What have you used? What have you enjoyed? And it doesn't have to be a supplement.
Okay, so supplement-wise, I notice such a big difference when I'm on them and I'm consistent versus when I'm not. And the ones that have helped me the most were the L-theanine stress calm you guys have. I don't know what ingredients are in that one.
Some ashwagandha and so many other things. I can look it up.
Inositol was helpful. When I was doing my fertility preservation stuff and just prepping my body, I was on CoQ10. And some other ones as well. But honestly, the stress calm and L-theanine were like the main ones. And even magnesium as well. The natural calm, I take it at night.
Yeah, so magnesium is a great one. It's just a great overall calming the body down, the muscles. And we tend to actually be really deficient in magnesium, most of us. So, yeah.
Stress calm is my favorite. As ashwagandha, California poppy, catnip, lavender, and lemon balm.
Yeah. Honestly, I noticed such a difference in my nervous system and my body. I've always been a really anxious person. I have PTSD, and it just calms my body down, and that works for me. So I think over the years we've tried different things, but that's the one we've been most consistent with, and my body just responds well to it.
Good. Okay. What do I want to ask next? Do you guys have any questions? Any thoughts? You can ask each other questions.
I guess what would be like the biggest concern or issues that you see that people ask you about for help for?
Good question. I would say a lot about relationships, their relationship with themselves, relationship with other people, setting boundaries, dealing with grief and the things that come out of that. Those are the main ones for sure.
How come in every group there's always that one person that listens to everyone's problems and wants to fix them?
What?
I just find that there's always that one person that is the best listener, and somehow it takes on the role of like Dear Abby.
Yeah.
And I tell everyone, please don't fix your friends. Please don't help your friends. Even in terms of relationships, don't hope that your boyfriend's going to be a counselor. 'Cause they make really bad ones.
Yeah.
Yeah.
Fair.
And
Yeah.
because it's normal. Like, as you talk to someone and you're upset and you want someone to calm you down, and that's very normal. But if you need that on a much more regular and or professional level, guys don't.
Yeah.
I know. You need to be self-sufficient. Like, you need to be able to get there on your own. Otherwise, you're going to just be relying on people, and it's too much.
I think we all need to rely on each other, but I think we have to kind of know when to discern. It's like, I need more help or more professional help, or because we talk to the people that are closest to us.
Yeah,
that's the easiest thing.
Right.
And sometimes like it's good enough. And then sometimes it's like, I'm only speaking because I've had enough guys tell me, it's like, I don't know what else to tell them. Because I feel like I'm in psychology. Like, the guy's like, he's a tradesman.
Yeah.
And it's not that they're not smart. It's just, I think even just with friends, like sometimes like it's good to cry on a shoulder and to share, but sometimes it's like there ends up being like a slanted relationship where one person is investing their heart and soul into helping someone, and that other individual sometimes is just like, I just needed to cry and I feel better now, but now I left all my luggage with you, so hold on to this until I come back to you and talk to you next week.
I think it's a vicious cycle. It's like that person's allowing it, so that person will come back, and then you're allowing it. And I think like if that person is, being your shoulder to cry on and always there for you, they're likely having that role in another part of their lives, maybe with their parents, they're being an emotional caregiver in that area, or with other people in their life. So
that's what I meant by that. There's the Dear Abby in every group, because they end up doing it for not just one. That's because I'll like, I kind of can see it with especially young girls, and they're like having like a lot of emotional stuff and anxiety, and maybe like say first year university. It's usually when it like really kind of, or near the end of high school. And there was like all this drama in high school, and they were like in the heart of it because they didn't want to see conflict, and they want to make friends, and they want everyone to be so much effort. Sometimes it's good to be by yourself.
Yeah, but I think it's also very important to have a good support group too.
What if you don't have good support?
That is tough, because then I feel like you would need maybe even then like something like a social media support, like something like your page or something like that. I feel like there needs to be somewhere to connect and know where to reach out to if you need it.
Yeah. I think if someone is getting to a point where like they're crying every day, or they're stressed out every day, or they're anxious every day, you need to go up a level in terms of who you're reaching out to, because maybe someone in your class isn't necessarily.
Yes.
I think you need to just try new spaces, go for new opportunities. Like for me, speaking on personal experience, I experienced my grief when I was, in high school, going into university. And at that point, it was really tough because there's so many transitions and changes you're going through. But with my friend group, I essentially lost everybody. So I was starting from scratch. But going to a university, being in a new space, connected me with people that I never would have connected with, and allowed me to, I don't know, just connect more with people who got me, and make choices that way. So I think just exploring new spaces can be helpful.
Yeah, that's a very transitional time, especially because I mean, usually, you're in high school and it's probably in your neighborhood, and it's probably your
It's
grade school
such a
was
small
right
circle,
beside.
yeah.
So you're around, if not the same people, the same kind of people.
Yep.
I mean, speaking from experience, grew up around this area.
Uh-huh.
When you go to like university or you start working or whatever it is, it's like, oh wow, there's life life south of Highway 7. I mean, for me, not so much anymore, but I mean, everything's north of Highway 7. But like before that, my high was in the bubble for sure.
Yeah.
And then it's like, oh wow, and then it's not all roses, but I mean, it is an experience you start to see, and you start to. And a lot of times, we're sheltered from what we understand because you only can see so much at a certain age, and then you start to learn and you go through things, and it's like, okay, well, I mean, it is a life experience, and you do learn from it. And I think that is the make or break of any situation, is if, you go through something, are you able to learn from it? Are you able to grow from it? Or is something in your development stifled at that time? And that's when problems can persist until you sort of trace back your steps and like, okay, where did I not accept something? Did I not understand something? Did I not understand what maybe I can learn from this? Because everything you can grow, but things can hurt you too. So these scars or these traumas, they happen, and you got to be able to like find healing. And sometimes it's a longer process. And sometimes you have to kind of, once you get some new pieces to the puzzle, then you're like, okay, I can, this is kind of getting me closer to where I want to be. And, you still learn, you still experience, you still have days.
And I think that works with people as well as like finding tools and strategies. Like, once you get to that point, you kind of get a clear idea of what your needs are and like, what you want to explore, whether it's, I don't know, you want to take up this activity, or you want to go to the gym, or you want to focus on your wellness. Like, I don't know, once you get to that point where you recognize that you can meet new people and like your life doesn't have to be just, cookie cutter or like have this fixed ending. Like you kind of get more in touch with what your needs are. So
you want to say something?
No. Sorry. That just like,
Jived with you?
Yeah. Just the whole like cookie cutter, like there's so much about you have to do this by this age and be here at this age, and there's so many expectations.
Is that still out there?
Oh, for sure.
Okay,
you have to have kids
mad.
by this.
How old are you?
Oh my God. I'm not getting mad, but
oh my gosh.
It is. It's like you have to do these by these certain ages, and
But who's the police?
Oh my gosh. It's a family thing too as well.
That's true.
I'm going to be 29 this year. My sister just got married, and at her wedding, I was asked 4 times, do I have a boyfriend? When am I getting married? When is it happening? I'm like, do you guys want to know about my work? Like what I'm doing? Or it was just all about like, when are you getting married? And I'm like, no.
So, I mean, it's a cultural component. And it's also a generational thing. Because the individuals that are asking you, probably that was what they accomplished.
Yeah.
But I feel like people our age even put that pressure on themselves too.
Yes.
There is that pressure. So, yeah.
I mean, there's the pressure to sort of like not stand out or stick out, or have like, I don't want to get asked again. I mean, after you have 1 kid or 2 kids or 3 kids, people will still keep asking you.
So you're saying it never ends?
Oh, hey. Jeez. You buy a house, when you get your next house?
Yeah.
You got a car, when you get your new car?
Yeah.
So, I mean, I think that's sort of like a basic person question. Like people just like, here's the first course, and before you've even eaten it, they're like, what's the second course? Yeah. People are just looking for what's next. That's just how their brain works. Like if I say 1 + 1, you're thinking, okay, 2.
Yeah, I guess, but I do.
It's annoying.
It is, and I think like Carm is right. Why aren't you asking me about what I've achieved, what I have done to help?
Maybe
You
they
know,
don't
I
want to be
think-
nosy.
But I think that shows
That's
a
a
lot
joke.
for your character too. And I think that's always like, no, you gotta just go in the steps of get married, have kids, and.
But I also think it's like the cultural thing too.
I
Like
think so
if you if they do ask you that and you respond, they probably like aren't.
What is that?
Yeah, like
What are
they're
you
not gonna
doing?
know. They're not gonna be prepared with a response.
No,
You know,
yeah.
they're not gonna have the right thing to say.
But do you think they're expecting a response? Like, do you think? I mean, I guess maybe I'm old, so now I'm just sort of like trying to. Like, well, that kind of maybe I would have asked the same question. Maybe that's just them showing like attention to you. It's because they
know.
think it's well.
But it's
once-
not nice. I don't want it.
I don't. There's one thing if you're being asked it by someone who's being catty, and it's like, where's your boyfriend?
Yeah.
Like, I don't think that's the case.
No, it's not.
Okay, so it's some sweet old lady asking you.
It is. And
Yeah.
I'm like, it's COVID. Where am I supposed to meet someone? Now I just get like sharp with it. Like,
Dang.
and that just stops it.
There's
so.
no boyfriends in COVID. I guess.
No.
Okay. So I kind of want to get some parting shots from everyone. I feel like this could be another podcast in the future where we kind of get into like the more nitty gritty of a trauma or a type of trauma or things that you're seeing more commonly. And, you know, because I think my hope is that people will watch and listen to this and they'll be like, oh, yeah, you know what? This touched upon a lot of things that I like to learn more about.
Mm-hmm.
So, I mean, this is something that I would love to do again. And that's always the point of one, is to not make it the last one. I always like to, again, I don't want to say I'm a jerk, but I don't ever want someone to lack the benefits of truth. So sometimes you have to be able to know how much someone at a given time is ready to hear.
Right.
And because you can, like, I could be arrogant and see someone for 5 minutes, like, I know everything that this person needs to hear, and I'm going to slap them across the head with it.
Mm-hmm.
Probably not going to help them. So that's something I've had to temper and be like, okay, this is going to be, you know, month by month, not day by day. What's something that, like, some truth that you've learned and it was like a pill to swallow, but it was a good one?
I need a second.
Yeah, because it was a little bit of a
big
loaded.
question.
That's a good way to end it.
Yeah, I could say just they're not always going to listen to everything you say, and you kind of have to meet them where they're at. So it's kind of similar to what you're saying. I notice that a lot in practice. So just recognizing that, like, needing to meet people where they're at. And it can be tough because I want to have this amazing plan for them and get them going on all these things, but they're not going to do it. And you need to know when they're ready and assess that readiness.
I've got mine. And I agree with that. Definitely meeting people where they're at. But also listening to your body and not fighting that, because when you do fight that, it's going to catch up to you eventually. And I think for me, as someone who's experienced trauma over the years, I definitely saw the impacts on my body and the impacts of pushing that to the side for so long. So I would say definitely listen to your body and just don't neglect yourself. Put in the time and energy now.
Priority one, that's your health,
Yeah.
yourself.
Yeah.
Make sure
Right.
you're okay. Listen to what your body's telling you. Putting things off doesn't work long term, especially as you get older, like older than 25. Because a lot of people, they'll be like, I used to be able to stay up all night. Now I can't do it anymore. I'm like, yeah, you shouldn't do that. Your body was giving you a break before. This was great. You guys are the best. Carm, Amanda, thank you.
You're very welcome.
I'll put
Thank
this
you.
on Instagram and on YouTube, and you guys feel free
Amazing.
to tag or share or whatever the
For sure.
lingo is. And until next time.
Until next time.
Okay.